Hello everyone, I am Dr. Anku Sachdeva. I am based in Dwarka, which is in New Delhi. I am into clinical practice for more than 2 decades. So, to start with today's session, first of all, this pandemic, what has happened this time, is once in a century pandemic. So, it is as new to you as it is to me. But dealing with COVID has given so much of insight to a clinician also. If I start my today's webinar, I would like to divide it into three subdivisions, that is pre-COVID, COVID, and post-COVID. Somebody is not able to hear my voice? Am I audible? Now, am I audible? Okay. So I think you have got a overview what exactly I am talking about. So we would start with the session. Like I have actually divided this COVID session into three. One is pre-COVID, then COVID, and post-COVID. Now, what is pre-COVID? Pre-COVID means what precautions we have to take before getting infected from COVID. There are few precautions which are associated with COVID only and few general precautions. Since last year, the governments have been stressing on three basic things. One is mask, second is social distancing, and third is frequent hand washing. Now, mask is essential because it protects your nose and mouth. As all of you might be aware of this thing, that generally the COVID virus enters through our orifices, nasal as well as mouth. So if we keep it covered, there are less chances of getting infected. What type of mask we should use? We have different type of masks nowadays: surgical mask, cloth mask, and N95 mask. Till last year, it was said that we should use N95 mask, but now they are saying double mask give better protection. If anybody is not able to get any kind of mask, then they should use simple cloth to cover their openings. Now, coming to social distancing, the governments have been saying to maintain a distance of 6 feet. अब 6 फीट की दूरी कभी कभी मेंटेन करना मुश्किल हो जाता है. सो इन दैट कंडीशन यू शुड कीप एज मच डिस्टेंस एज पॉसिबल बिटवीन two individuals. Now, hand wash. Coming to hand wash, it is advisable to wash the hands as frequently as possible with soap and water. At times, one is not able to wash it with soap and water, then one should use sanitization for surface areas. Other than these three basic things, there are few things which help in immunity boosting. They are basically diet and exercise. This applies not only to COVID but to rest of the diseases also. Good diet is very important for immunity. Now, good diet can be all the essential nutrients, vitamins, minerals, as well as good amount of protein. Exercise, as a clinician, I would like everybody to do whatever exercise they can do for 20 to 40 minutes. Having such a lifestyle in which we are not exercising, we are just sitting, this adds to this reduced blood flow, which increases the chances of having infection. I hope I am able to explain the pre-COVID time. Now, coming to the COVID time, there are three basic rules of COVID. One is testing, second is treatment, and third is isolation. There are two gold standards of testing in India. One is rapid antigen test and second is RT-PCR test. Rapid antigen test, the good thing of rapid antigen test is that it tells the report immediately, and if it is positive, then patient is considered to be COVID positive. But in case rapid antigen is negative, then it is advisable to go for RT-PCR because RT-PCR gives a better report. Now, till last year, we were just relying on RT-PCR. This time, during this second wave, it has been found that the virus has mutated. So, in some cases, though the RT-PCR was negative, still people were found to be COVID positive. So, this time, one more investigation, or rather, we can say two, three more investigations have come into picture. They are CT scan as well as few blood tests. Now, before going to the treatment part, I would like to tell all of you about few basic features of COVID. As all of you might be aware of different features of COVID through different social platform or print media or news media. They are sore throat, fever, and cough. But in clinical practice, we do see many patients who are not having any of these symptoms. They may be having any abdominal symptom like loose motion. They may be having any redness of the eyes. There may be some skin allergies and severe muscle pain also. Now, to elaborate on that point, I would like to tell few of my cases. My first case, this is a lady who is 28-year-old. She came to me in end of April. She had history of cesarean section 2 years back. She came to me limping with severe low backache and radiation to the lower leg. She was not having any fever, but she was not able to stand properly. When I asked her about her features, she said it cannot be COVID because I'm not having any sore throat or cough. When I insisted that you should go for test, then she went in for RT-PCR test. It turned out to be positive, and without any other medication, just with COVID medicine, this lady recovered fully at home. Now, second of my patient is a 75-year-old male. He has been a known chronic obstructive pulmonary disease patient. That means, in simple words, it is bronchial asthma. He has been coming to me for more than 7 years, and every time he used to come to me, I would give him medicines and he would recover. Now, this time, the only other feature was he was having fever. But when I insisted on RT-PCR, initially he was also of the view that every time हम आपके पास आते हैं, आप टेस्ट कराते हो और हम ठीक हो जाते हैं, तो RT-PCR की कोई ज़रूरत ही नहीं है, because according to him, he was not moving out of his house for past 1.5 years because his children told that since you are 75-year-old, you should stay in home. But upon my insistence, he went in for RT-PCR, and you will not believe his RT-PCR was positive, and even he had COVID pneumonitis, which was evident only on CT scan thorax. But he also recovered fully because we started the treatment on time. Third patient, she did not have any features. The only feature she had was loose motion for continuous 2 weeks. She had been to gastroenterologist also. She had been to different practitioners also. I did not give her anything, to be very true and frank, because her treatment was going perfect. I just told her once your COVID will be over, your loose motion will subside. And ultimately it happened that when she finished her 14 days quarantine, she was absolutely fine. Now, my fourth case was actually a surprise for me also. Small baby, 6 month old, breastfed. Parents came with loose motion. There was no history of fever. and everybody in the family was thinking that the child is suffering from teething problem. According to the parents, even parents did not have any fever, but that child had turned out to be COVID positive. So now why am I telling you all these things? Because generally people do not accept that they may be having any symptoms of COVID. As far as treatment of COVID is concerned, it's a very narrow path. You do not have to overcross this path. Neither you have to go for under treatment nor for over treatment. There are few people who through WhatsApp or different platform ask their relatives to give them treatment and then they start at home. Do not ever do that, because whatever said and done, a doctor is better equipped to handle the situation. And do not think that a medicine that has worked on one patient will work on each and every patient. ठीक है, मैं हिंदी में बोलती हूँ, आपने मुझे हिंदी में बोला, मैं हिंदी में बोलती हूँ. तो मैं ये कह रही थी कि आप ये मत सोचें कि जो ट्रीटमेंट एक मरीज के ऊपर चल रहा है वही सब मरीजों के ऊपर चलेगा. एक बहुत क्लोज मॉनिटरिंग की ज़रूरत होती है ये देखने के लिए कि किस मरीज को किस समय पे क्या दवाई देनी होती है. पिछले साल तक हम लोग बेसिकली कुछ दवाइयाँ दे रहे थे, जैसे क्लोरोक्विन और कुछ और मेडिसिन. इस बार प्लाज्मा थेरेपी लास्ट ईयर दिया था, इस बार क्लोरोक्विन और प्लाज्मा थेरेपी यूज़ नहीं हुआ है. इस बार ज़्यादातर हमें कुछ पेशेंट्स में एंटीवायरल देने पड़े हैं, कुछ में हमें स्टीरॉइड्स देने पड़े हैं, कुछ में एंटीकोएगुलेंट्स देने पड़े हैं. सो बिकॉज वायरस चेंज हुआ, मेडिसिन का प्रोटोकॉल चेंज हुआ. अगर किसी भी तरीके से कोविड का कोई एक ट्रीटमेंट होता तो इतनी मोर्टेलिटी ना होती. We would not have lost so many lives because there is no standard protocol, there is no standard treatment. अब जो नेक्स्ट बात आती है वो है आइसोलेशन. आइसोलेशन आप लोगों को पता है कि 14 डेज का बोला जाता है. यूएस यूके में 10 दिन का आइसोलेशन है, इंडिया में शुरू में 17 डेज का बोल रहे थे. अब ये डिफरेंस किस लिए है? क्योंकि जो वायरस होता है वो शुरू के 9 दिन वायरुलेंट होता है, मतलब वो शुरू के 9 दिन एक पर्सन से दूसरे पर्सन को इन्फेक्ट कर सकता है. उसके बाद उसकी वायरुलेंस कम हो जाती है. बट कुछ लोगों में okay, I'll mix and match. Okay, fine, Uday Shankar, I'll do that. So in some people, infectivity may be prolonged for a little longer time. So in those people we may have to increase the isolation time. Even if the RT-PCR is coming positive after 2 weeks, that doesn't mean that the person is still suffering from COVID. Generally, by and large, the infectivity or the virulence reduces by 9th or 10th day. So ideally, if it is not required by your offices, we do not recommend repeat RT-PCR tests. Only if the patient is admitted in the hospital, they say you have to go for repeat RT-PCR test. Now, from this platform, I would like to tell all of you about few danger signs if a person is in home isolation. As most of you might be knowing, that there are a few basic things that one should have if a person is having COVID. One is thermometer to check the temperature regularly. Second is pulse oximeter to check the oxygen regularly. Now, one should use the dominant hand. मतलब अगर आप सीधा हाथ यूज करते हो तो बीच वाली उंगली, अगर आप उल्टा हाथ यूज करते हो तो बीच वाली उंगली. You must keep your hand straight on a flat surface like this and put the pulse oximeter in your middle finger. Keep it stable for some time, 30 seconds to 60 seconds. Let it rest and then check the pulse oximeter. During some time, like once one is back from washroom or once one has got up, then there are chances that it may show less oxygen saturation. Do not jump into conclusion immediately. Wait for some time before thinking that there is any drop in oxygen. Other than oxygen saturation, the third thing that is very important is exhaustion. At times, people may not have drop in oxygen, but they may be having exhaustion. Like whenever they are talking, they are getting exhausted. Whenever they are walking, they are getting exhausted. So there is one simple test that is known as 6 minute walk challenge, that you walk for 6 minutes in your room. After that, you should check the oxygen saturation. If it is dropping drastically, this is also one of the signs. Persistent high temperature for more than 5 to 7 days is again a sign of increasing viral load, increasing viremia, that is the cytokine storm. Other than that, some people may be having loose motion and vomiting. If anybody is having loose motion and vomiting for longer time, then they may also go in for electrolyte imbalance and they may also require admission. So you should be aware of these things other than the basic oxygen saturation that everybody is aware of. Coming to the medicine part, as I told you initially that there are few medicine, even this time remdesivir and other things have been used. कोविड में इसके अलावा जब हम मेडिसिन दे रहे हैं, पेशेंट का ऑक्सीजन सैचुरेशन चेक कर रहे हैं, उसके अलावा स्टीम लेना या नेबुलाइजेशन लेना, दैट ऑल्सो हेल्प्स अ लॉट, बिकॉज कोविड के कारण ड्राइनेस हो जाती है, तो यू हैव टू लिक्विफाई द सिक्रीशन. तो इसीलिए बोलते हैं पानी ज़्यादा पियो, क्योंकि जितना आप अपने सिक्रीशन को लिक्विफाई करोगे उतना वो आराम से निकलेगा. अब हम आते हैं अपने पोस्ट कोविड केयर में. पोस्ट कोविड केयर का मतलब है जब कोई कोविड से ठीक होने के बाद अपने घर पे अब रेस्ट कर रहे हैं, तो उनको क्या क्या फीचर्स हो सकते हैं. देयर आर फ्यू बेसिक थिंग्स दैट मे बी सीन इन मैनी पीपल. Again, it is not generalized, but what we see in clinics basically is myalgia, muscle pain. Many people complain of muscle pain. Fatigue means exhaustion. As all of you are aware, that human body is not a machine. It is not that you do the ignition, it will start, and you stop the ignition, it will stop. It takes time. Whatever we see even in sports, that people do warm up, then do active exercise, then there is cool down. So wait for your body to recuperate with the disease. Do not overstress at that time. Everybody is different. Everybody takes its own time as per their immunity. Some people may take even 10 days and it may go up from 1 month to 3 months. So do not overexert in initial times. Do not go running, jogging immediately. Give some time to the body. Other than myalgia and fatigue, people generally complain of headache, dryness of mouth. Now, dryness of mouth can be because of a lethargic lifestyle. Like for the past 12 or 14 days, a person has been in one room. Second could be because of increase intake of things which cause dryness. It could be basically we are taking warm things more, so that can also cause acidity. Even things like the acidity also can cause dryness of mouth. Now, to recover from COVID, one requires few things. The first and foremost is exercise, as I told just now. Do start with walking. But nowadays, as in many areas, lockdown is going on. So do not go for, in the areas where it is allowed, you can go for walking. In the areas where it is not allowed, do not go out. And whenever you start walking, start with face mask and slow walking. That also should not be very brisk initially. Second thing that helps is sunlight. Most of you would have taken vitamin D as a supplement in your diet. Being a tropical country, we have enough of sunlight, which we do not use. Try taking sunlight for 20 minutes if possible during morning hour or late night or late evening, I'm sorry, so that your bones get enough of sunlight and that is naturally absorbing the vitamin D for your bones. Third thing is ample amount of water. Now this liquid thing does not apply only to COVID, it is generally for all the diseases. Human body requires 3 to 5 liters of liquid during summers and 2 to 3 liters of liquid during winters. तो जो लोग पानी या लिक्विड खूब अच्छा पीते हैं वो जल्दी बीमारियों से ठीक होते हैं. उसके अलावा विटामिन पे आते हैं. वी हैव many vitamins. We do have many vitamins in the form of medicines, but nature has also given us vitamins in the form of raw fruit and vegetable. Go for colorful things, red, green, yellow, whatever is available in your area, and take raw fruit and vegetable. Every time taking cooked food is not good for body, because then your intestines are not working to the extent that they should be working. That is the reason why we see a lot of acidity cases nowadays. So increase raw fruit and vegetable in your diet. And then coming to protein. Protein, as all of you might be aware of, bodybuilding food होते हैं. So try taking whatever protein you can take. It can be veg protein like dal, paneer, soybean. It can be non-veg protein like meat, fish, chicken, mutton, whatever. Eggs also can be included. Even protein powders can be taken. As far as medicine supplements are concerned, there are many medicines which are given in post-COVID time. Calcium, neurovitamin, vitamin D. But then it should again be treated individually as per your doctor. Be in touch with your doctor. Just follow whatever he or she is saying. Then you will be in safe hands. I think I have explained the post-COVID time also. Now coming to vaccination. Vaccination is a wonderful thing. We as medical fraternity have seen very less mortality in people who have got both the vaccines. Most of us have been vaccinated in February or March at the max. And that gave us an edge during the second wave. Now, as per government data or by DGCI approval, we have 3 vaccines which currently we are giving in India. One is Covishield. Now, Covishield initially was given with a gap of 2 doses. Initially, it was 4 weeks, but now, after the scientific research or due to data, the government has increased it to 12 weeks to 16 weeks, depending upon the severity or depending upon the availability. Covaxin is still maintaining 4 weeks interval between 2 doses. Sputnik is single dose. Now, if a person has already got COVID now, then when the person should take the second dose? So initially we were advising to take the second dose 2 weeks after recovery. Suppose a person has got COVID on 1st, then from 1st to 14, already the person was in quarantine. So 2 weeks from 14, that is 28. After 28, a person is eligible to take COVID vaccine. But now with the increasing scientific data, the government has said that since the person is already having COVID antibodies, then he or she may wait for 3 months before getting their second dose or first dose, whatever. In India, it has now been recommended in lactating women also. US, UK are giving to pregnant female also, and in US they have started vaccination even for children from 12 to 18 years of age. India is still moving ahead. As per the scientific data, they will decide whatever they have to decide. But as medical fraternity will go by whatever the government is saying. I believe I have explained in nutshell whatever I wanted to explain. And before I leave this session, I would like to thank Secure Now India team for giving me a platform to reach out to you people. But I will be in touch with you now for the question answers. Thank you everyone for joining in. So just now I saw a question that for some person the CRP has increased. Now CRP is a marker of inflammation, and only CRP is not the criteria of having a active disease. Keep keep a check on the CRP. You can get it repeated after 2 weeks. If it is still on the higher side, then you have to go for few more tests like CBC, D dimer, and even CT scan. But only CRP does not mean that you are having too much of problem. You need to wait for some more time. Then one more question has come that sugar level has increased. It is a very common thing which we have seen this time. Partly it is because of the COVID, and partly it is because of the steroids. It happens with many people, but do not panic. Do not panic at all, because generally it will take 1 to 3 months to come down. Initially, you should start with oral hypoglycemics in consultation with your treating doctor. If that is not helping, then you may have to shift to insulin for some time. But do not think that the insulin will be forever. You will come back to oral hypoglycemics or maybe to normal. But just keep yourself under a good physician. As far as this question that you are not getting Covaxin or this, I am so sorry. You will have to see it at the government portal. Now this question, like before the RT-PCR report is coming, what medicine one can take? So the basic three medicines that one can take is paracetamol, zinc, and vitamin C. Zinc is 50 milligram once a day. Vitamin C is 500 milligram twice a day. That is a chewable tablet. And paracetamol, depending upon the weight of the patient, it is given. It is if the patient is above 50 kg, it can be given 650 milligram 3 times a day. And if the person is overweight, it can be increased to 4 to 6 hourly, depending upon the severity of the disease. And now this question, is it okay to take doxycycline tablet for more than a week if tested positive? Doxycycline is an antibiotic. Now, normally in the initial 5 days, doxycycline is given. For some people, we may have to shift to a stronger antibiotic. Depending upon the severity. If the oxygen saturation is going down, if the temperature is persisting, we actually stop doxycycline and we shift to the stronger antibiotic. But if the patient is having mild symptom, then as per the patient, we may have to continue the same medicine for 1 week, or we may actually withdraw the medicine. So that's what I've been telling 2-3 times. Do not take the call yourself. Let the doctor take the call. Acha. Should we avoid blood thinner before 24 hours of vaccination? Yes, you should avoid that. Which vaccination is considered better? My medical fraternity, for us, actually all the vaccines which are recognized by DGCI are good. Okay, even we are taking as per the availability. See, it is very difficult to say whether the vaccine is working or not, because vaccination, after vaccination you got fever and headache. That means ki the vaccine, that doesn't mean that the antibody has formed or antibody has not formed. It is not a sign. It is just ki it is one of the normal complaints that we get after vaccination. And please do not go for antibody titer test. That is actually not very helpful test as per my clinical observation. Acha, what will be the exact precaution need to take outside those who yet have not got vaccination? The same thing that I told pre-COVID वाले time में, mask, sanitization and social distancing. And one very important thing which I keep telling all my patients also, please stay away from negative news. All your healing gets delayed if you are sticking to the negative cases. We have seen some people recovering so beautifully at home because they were not going after the news. This question: 15 days back, you had severe chest congestion, body pain, headache, and fever for 1 day. It is all like COVID, and you tested negative. By suggestion of one doctor, I have taken the medicine. Mukesh, the thing that at times I told initially also, this time approximately 30% cases were RT-PCR negative, and they had all the features of COVID. So if you are feeling anything and you want to rule out that it is COVID or not, anyway you have already finished your 3 weeks, so active तो नहीं है अभी भी आपका. बट आपको अगर ये देखना है कि उसका आपके लंग्स पे या कोई और फर्क आया है कि नहीं है, गो फॉर एक्सरे चेस्ट, सीबीसी, सीआरपी, डी डाइमर. बेसिक टेस्ट है ये, सीबीसी, सीआरपी, डी डाइमर एंड एक्सरे चेस्ट. एंड अगर एक्सरे चेस्ट में कुछ शो होगा, देन गो फॉर सीटी स्कैन. दैट विल टेल कि कुछ उसका रेमिनेंट है कि नहीं है. हाउ इफेक्टिव इज वैक्सीनेशन? इट इज वेरी इफेक्टिव. Mortality rate was just 0.6% in people who were having two vaccines of COVID. And in some people, yeah, comorbidity जिनमें थी कि डायबिटीज था या ओल्ड एज थी या कोई और प्रॉब्लम थी, उनमें there was a mixed war, but it is very effective. One must go for vaccination. Now this question: in post-COVID with normal saturation, the pulse rate is increasing from 100 to 110, sometimes less than 100. Now, the pulse rate, again, can be because of three things. One, it can be because of anxiety. जैसे हम जब भाग के आते हैं, तब अगर चेक करें तो हमारी पल्स रेट ज़्यादा आती है ना. जब हमें स्ट्रेस होता है कि कुछ होगा तो नहीं, तब भी पल्स रेट ज़्यादा आती है. लेकिन अगर कुछ भी नहीं है, आपको स्ट्रेस भी नहीं है, तब भी अगर पल्स रेट ज़्यादा आ रही है, गो फॉर ECG टू रूल आउट मायोकार्डाइटिस. अच्छा, ये जो क्वेश्चन है ना, व्हाट मेडिसिन शुड वी कीप एट होम फॉर चिल्ड्रन सेफ्टी इफ कोविड इन्फेक्टेड? मैंने अपने घर पे, यू विल नॉट बिलीव, आई डिड नॉट कीप एनी ऑक्सीजन सिलेंडर और ऑक्सीजन कंसंट्रेटर एट होम, बिकॉज वाई वरी, जब होगा तब की तब देखी जाएगी. और बच्चों को कुछ नहीं देना, बच्चे रिकवर मच फास्टर देन एडल्ट्स. जस्ट गिव देम गुड फूड, विटामिन डी दे सकते हो आप, और उनको घर में खेलने कूदने दो पूरा. ठीक है, ऐसे कोई और मेडिसिन की जरूरत नहीं होती है. अगर बाय चांस होगा तब की तब देखी जाएगी, पहले से कोई मेडिसिन स्टोर मत करो. This question: you have taken 2 doses, should I take antigen test? You should not take antigen test. Why go for antigen test? Not even antibody test. This thing that you have tested positive and you are still having headache, no mouth taste or smell. Now the taste and smell may take days to weeks to come down. ठीक है, it is one of the mildest feature of COVID. Headache also may persist for little longer time. For some people, it may persist for 2 weeks. So they are very mild features. Do not worry about that. But you can take antacid medicine for that. That will help. But taste and smell will come naturally. No medicine will work in that. CRP 5.2 is very okay. Mild infection only. Nothing to worry about. Zinc or any other tablet to boost up the immune system, yes, it can be taken. Zinc, vitamin C, and even calcium with vitamin D do help. Acha, how many months will one affect COVID positive again? For some people, the immunity is there for 6 to 9 months against COVID, and for some people, it may be for 3 months only. So, depending upon person to person, it may vary. One vaccine dose provides some protection from COVID. See, something is better than nothing. But yes, 2 doses give much better protection. But if you're not getting 2 doses, still go for single dose. This is not a good sign that initially your oxygen saturation went to 89-90. It is 96. Okay. Now it is 93-94. Did you go for HRCT, Santosh? Or blood markers, the viral markers, CBC, CRP, D dimer? Did you go for that? 94 तक ठीक है, 93 थोड़ा सा border होता है. And one very important thing about which I don't know how I forgot to tell you, deep breathing exercises are very, very important. Deep breathing exercise, you can even during COVID time and post COVID time, both the times deep breathing help a lot. Okay, your HRCT was done. Fine. How much was the score? Yes, these things can be taken. Haldi milk can be taken. Achha, steam vapor daily helpful. If you are suffering from COVID, it does help. But if you're not suffering from COVID, then it may help in purification. And even this anulom vilom pranayam, that the alternate nostril breathing. You put your thumb on one nostril, take full inhalation, then from the second nostril, you put your middle finger and then do full exhalation. That helps. HRCT 9 by 25. So it was on the border. That was moderate pneumonia. So it's been how many days you have? It's 14 days after your quarantine is over, Santosh. So it was from 21st April to 13th May. Now today is 15 days after that. That is, and now the saturation is still 93, 94. Okay. Do one thing. Go for one X-ray chest or CT scan chest. And if it is still showing some fibrobesities in the lung, then you must go for blood thinner as well as few medicines for fibrosis. Do consult your physician for this thing. Normally, in some people, fibrobesities may persist, and these people may require medication for 1 to 3 months. Active medication for 1 month, and then passive for 2 more months. But do see your physician once. Now you can go to the clinic actually. Yes, anybody who is taking any medication for stone can go for vaccination. Blood thinner in the recovery of COVID. How long can it be given? It can be given for 1 month, depending upon severity. There is no standard protocol that every person will follow the same thing. That is okay. 75-20 is good. You can take EcoSprint, but other than that, there are few other few other anticoagulants other than EcoSprint also, which can be added. Yeah, this thing, the new talk about zinc consumption can cause mucormycosis. The thing is, everybody, including the scientists and the medical fraternity, it is all an ongoing process. Every day the new research comes. For some people, they say, initially it was said that mucormycosis was because of the steroid. Then they said no, it was because of the industrial oxygen. Now they're saying it is because of zinc. I am actually not sure what exactly is the thing. Yes, if you are taking medicine for nerve problem, you can take vaccination. Niranjan, normally the dose that is recommended is 50 milligram a day of zinc. But if you have already consumed, then you can actually stop zinc. One problem that generally we see because of zinc is acidity. If anybody else has any questions. Now, zinc as precaution. See, I generally recommend my patient to take for 1 month, but generally not beyond that. But I do not know how exactly people are giving, and but I am in my clinical practice. I am doing it for 1 month. But Rahul, if you ask me, na, the better way is to drink a lot of water, to do deep breathing exercises, and if there is anything like that, go for steam inhalation or nebulization. Yeah, 50 milligram per day. Yeah, for a month. Very true. Yes, it is a very good advice that your doctor has advised, because it is deep inhalation, then stop, and then go for exhalation. It's a very good advice. I really appreciate that. So Kaushik, if the chest X-ray is showing some infection, then X-ray ideally should be given PA view, that is posterior anterior view, because lungs पीछे से ज़्यादा अच्छे दिखते हैं. AP view is advisable only in case of bony injury. किसी का fracture वगैरह कुछ होता है, तब we go for X-ray, AP view. कौशिक, अगर अभी भी आपका ये चल रहा है, go for HRCT thorax to rule out COVID की fibromastitis. Water plus deep breathing plus steam inhalation. Yes, Rahul, this is the best thing. Yes, Rajan, your platelet have gone down to 1.49, which is still okay. We have seen people with platelet going close to 70,000 also. Because as you see in dengue, platelet comes down. It's again a viral infection, and COVID also a viral infection. It affects, and there is depletion in platelet. We have seen it commonly. Nothing to worry about it. Once you will be fine, the platelet will grow, will increase on its own. But again, even in dengue, we used to say drink plenty of water. The same thing, the same advice goes here. Yes, Arvind, if somebody is having fever for last 3 days, one should go for COVID test. Now, testing of COVID should not be done premature also. After 3 days is the best time to go for RT-PCR. कपिल, अगर आपके चेस्ट में मॉडरेट निमोनिया था और आपको अगर उन्होंने ब्लड थिनर 1 महीने के लिए बोला है, देन कंटिन्यू विद ब्लड थिनर. अगर आपका मॉडरेट निमोनिया नहीं था, देन यू कैन स्टॉप द ब्लड थिनर. हाँ, one more thing about blood thinner. Some people may be having some blood loss, like epistaxis from the nose, या vomiting में, या किसी में blood आता है, then you should stop it immediately. Blood thinner should not be used in any case where there is any loss of blood from any of the orifices. Anybody who is having any problem, say liver infection or kidney problem or diabetes or immunocompromised cancer or anything like that, they can go for vaccination. Only people who are on blood thinners regularly, only those people need to be little cautious. Rest everybody can go. SGPT 110 में भी आप जा सकते हो, कुछ नहीं होता है. If your cough is reducing, then you can because आपका I forgot you were on blood thinner. हाँ हाँ, you were on blood thinner. आपका HRCT स्कोर कितना था कौशिक? इनिशियली हुआ था आपका? और कितने टाइम आपको रहा था? I need that clarity, then I'll be able to tell you. Oh, I'm sorry. It was a question by Kapil. I'm really sorry. I got confused. ठीक है. अगर आपकी कफ रिड्यूस हो गई है, देन यू नीड नॉट गो फॉर सीटी स्कैन, और कोविड पॉजिटिव के हिसाब से ही डिसाइड किया जाता है. ठीक है. Any other query by anybody? Thank you, Niranjan. Yeah, Prem, I'm based in Dwarka, New Delhi. So, Kaushik, your cough is more at night time or during daytime? Subrat, there is no need to go for COVID test right now, because already you have finished your 15 days. The better thing to go for is X-ray chest. If X-ray chest is showing something, then only you require anything. But RT-PCR does not have any rule, as I told initially also, कि first 9 to 10 days में ही होता है. अगर positive अब आ भी गया तो हमने actively कुछ नहीं करना. You are out of the difficult period now. 15 days मतलब आप बिल्कुल safe हो. हाँ, उसका कोई इफेक्ट आपकी बॉडी पे है कि नहीं है, ये चीज आपकी एक्सरे से क्लियर होगी. It's sector 19. During evening time, when you lie down, Kaushik, you have cough, then you should take some bronchodilator. That will help you. Yeah, Subrat, tell me. Now this is Anuran. I would not advise this thing, because I have seen so many people who are starting steroid on day 2 or day 3 of the therapy. It is not advisable. Steroids should be added only under medical consultation, with all the blood tests, with all the X-ray or CT scan. Do not take steroid unnecessarily. स्टीरॉयड लेने से इम्यूनिटी और कम होती है और इन्फेक्शन बढ़ सकता है, बट जिसमें निमोनिया हो जाता है उसमें स्टीरॉयड देने पड़ते हैं. तो ऐसे अपने आप मत स्टार्ट करना. ठीक है, स्टीरॉयड मत स्टार्ट करना. One has to take if there is viral pneumonia. One has to take if it is causing drop in oxygen. But if both the features are not there, do not start that. Ascoril D plus is basically for dry cough. If you are having dry cough, it is good. Otherwise, you can take Ascoril LS also. Rahul, actually, again the same thing. Nobody is clear how the virus spread, whether it is aerial spread or through surface spread. The reason why we have been doing sanitization is because we believe that it stays on the surface and stays for some little longer time. As far as kitchen slab, table and everything is concerned, if you are not coming in contact with any active person, then you need not clean it regularly with sanitizer. But if you have any maid servant coming to your house, then at that time you can, I mean, once she leaves, you can do little bit of sanitization in your house. And in your workplace, like we do in our clinic, once the patient leaves, we try to sanitize as much area as possible. Oxygen level 98 is very good, Kaushik. Do not worry at all. Do not worry at all. You just take bronchodilator, take nebulization with Butycort, that will help you. And in there, as far as this black fungus thing is concerned, black fungus is basically a disease in which the fungus grows in the eyes, nose, and sinus area. Uh, we used to see few cases, but now cases have increased. But as far as guideline is concerned, this again, this is controversial. Some people say it is because of industrial oxygen, some people say it is because of other things. Do take steam, that will help you. Normal water steam will help you. If something came out in x-ray, then what medication? For that, Subrat, you need to see a physician. See a physician, because without that it will be very difficult for me to tell right now. So Pooja, I told you na, if somebody had the first dose of vaccine and then the person turned positive, then government says that the person is already having antibodies for another 3 months, so he can actually delay the vaccination for 12 weeks. Rahul, it's a difficult question. Food from outside, I'm not very sure. I'm actually not very sure. Doxycycline is a good medicine. No, Kiran, I won't be able to suggest any brand, but go for authentic brand. I mean, do not buy very cheap brand. Sajjad, this is a very common thing. People do have thigh pain. If it is not related to COVID, then it is basically deficiency. General deficiencies, L-carnitine. So if you take something like Evion LC or Neurokind LC with LC, L-carnitine, that will help you. Plus, if your job requires a lot of standing, then while sleeping, you can put a pillow under your feet. That will help you. Even hot massage helps. If you're doing massage backward from the foot towards the heart, that helps. Mahalakshmi, your dad is still admitted. You are asking about his vaccination or your vaccination? If it is about his vaccination, then as I told, that you can delay it. No, Kiran, I do not have any idea. Yes, pillow is helping you now, so that means it is basically because of blood circulation. Use L-carnitine, that will help you. Mahalakshmi, his vaccination you should delay for 12 weeks after his recovery. Avoid, Niranjan, if you are getting allergy due to sanitizer, then avoid that. We see a lot of cases having allergy due to sanitizer. Do not use that. Now, for alternative to sanitization, you can use simple spirit or alcohol without any additive color. That helps. हाँ सुनीता जी, बताइए क्या पूछना है आपने. आप क्वेश्चन लिख दीजिए, मैं आपको हिंदी में जवाब दे दूंगी. जो भी कोविड पॉजिटिव पेशेंट हैं, जिनका जो कोविड पॉजिटिव से नेगेटिव हो गए हैं, वो 3 महीने के बाद में वैक्सीनेशन करवा सकते हैं. Anuran, the main thing that is troubling nowadays post-COVID is the organ. If you talk about organ, basically, as you see, black fungus, I told, sinus में होता है. उसके अलावा myocarditis is a very common thing. Heart, अगर हार्ट रेट कुछ चेंज होता है तो फिर हमें थोड़ा सा ध्यान रखना होता है, अदरवाइज ठीक हो जाता है. Actually, both the medicine, Evion LC or Neurokind LC, yeah, both are fine, but these are different. Evion is vitamin E, Neurokind is Neurobion. So whatever you get, Neurokind में NE नहीं है, NURO. Now, foot pain, Gitanjali, you are having, it is post-COVID or is it normal only? Aishwarya, you should not go for running, gymming immediately after vaccine. Normally, it is said that you should wait for 72 hours or even 5 days for going for active exercise, because initially the body is in low immunity zone, so you may catch infection during that time. If it is normal, then lower leg में pain can be because of the same thing I told Sajjad कि ज़्यादा देर खड़े होने से हो सकता है या पैरों पे वेट पड़ने के कारण हो सकता है. सो रात को ऑल्टरनेट हॉट एंड कोल्ड फॉर्मेंटेशन करके, मतलब एक बार गर्म में और एक बार ठंडे में पैर डाल के और पैर पे मसाज करके, जैसे फुट पे अपने हाथ की तली से ऐसे पीछे वाले हिस्से से मसाज करके और पैर के नीचे तकिया रख के सो. फिर भी अगर परसिस्ट करता है तो फिर आप एक एक्सरे कैल्केनियल स्पर को रूल आउट करने के लिए करवा सकते हो. It can be used for non-COVID persons. Yes. Once a day only, Sajjad. Only once a day. Thank you, Gitanjali. Anuran, this is a very, I do not know. Actually, people can contact COVID any day. Why you blame it on the day of vaccination? Thank you, Niranjan. Thank you, Sajjad. Stay positive. Positivity helps a lot. It helps a lot. Do deep breathing. Heel area pain is basically because of the posture only. That's what I've been telling. Most of you people might be sitting on your laptop or sitting in the chair. बीच बीच में पैर उठा लिया करो ऊपर. हर टाइम पैर लटके रहते हैं ना, उससे पैरों में ज्यादा दर्द होता है. पैर बीच बीच में सामने वाली चेयर पे थोड़ी देर के लिए खोल लिया और घर जाने के बाद एक गर्म पानी का पतीला, एक ठंडे पानी का पतीला लिया. पहले गर्म में पैर रखो, फिर ठंडे में रखो, ऑल्टरनेट करके थोड़ा सा. अगर 10-15 मिनट के करने के बाद पैर के हाथ के इस वाले हिस्से से पैर पे मसाज करके, नॉर्मल तेल से मसाज करके और पैर के नीचे तकिया रख के सो, उससे बहुत आराम पड़ेगा पैरों में. वेलकम प्रेम, वेलकम हरदीप, थैंक यू स्नेहलता. I hope I am able to clear everybody's doubt. So shall we wrap up? Thank you, Sneh. Yes, Sudrat, I told you na. I've explained everything about vaccination. Thanks, Sunita. Most welcome, Santosh. Thanks, Aishwarya, Lata, Kiran.